The lack of widespread testing for the coronavirus has been a major frustration for health officials, physicians, and even the public. People showing symptoms want to know if they've got it. And today, Oregon Governor Kate Brown said soon there will be more tests.
We are expecting testing capacity to ramp up substantially in the next 3 weeks.
The governor said additional tests will be made available by a private provider and the federal government. The White House promised 1 million tests this week nationwide, followed by 2 million tests next week and 5 million tests in 3 weeks, although it's not clear how many will be allocated to Oregon. Which raises a few basic questions. Right now, how many people have been tested? As of Monday, 920 people have been tested for coronavirus in Oregon. That's nowhere near the 12,000 people tested in Washington or 2,300 tested in Minnesota. So why is Oregon lagging behind? The governors blamed the federal government for not providing enough test kits. And we don't have the same testing capacity as other states with numerous health labs or big universities. Right now, the Oregon State Public Health Lab is doing about 80 tests per day. So who is getting tested? Well, because of the limited supply, the state is rationing testing for certain groups. Doctors are told to limit testing to patients showing symptoms of coronavirus who are healthcare providers, residents of a high-risk site like a nursing home, and those at risk because of age or an underlying medical condition. But again, that may change as more tests become available. And how about those drive-through test sites? We see them on the news.
From Connecticut to Colorado, Ohio to Alabama, roughly a dozen states are now offering drive-through COVID-19 testing.
Governor Brown said it's something she's considering, assuming it's well planned out.
Obviously, I'm not very interested in people sitting in a 3-hour line. So we want to make sure we do this right.
Health officials hope more testing will lead to better surveillance for the disease. That means they'll know who's got it and maybe where it's headed next.
Okay, typically at the end of one of Kyle's pieces, we would be standing in the studio and chatting that way. But because a lot of our reporters are working remotely right now, Kyle has been filing his reports from home, and that's where he joins us right now. Kyle, thank you for the report. And also I wanted to talk a little bit about some of the people you've been talking to who have tried to get testing and haven't been able to.
Yeah, I put a message out on Twitter, actually, saying, listen, I want to hear from people. I want to hear about their experiences. And I heard from quite a few people, they wanted to remain anonymous, which I totally get. But many of them said, listen, I'm showing symptoms or have shown symptoms. And that includes some older adults, also healthcare workers. And unfortunately, they're really frustrated because they're not able to get that test.
Are they anxious, nervous? Are they worried about spreading this? What are the concerns that they're telling you?
Right. Well, not only are they worried about their own well-being, but their family members. I spoke with one gentleman whose wife has a medical condition. He's worried about her well-being. If he has it, he doesn't want to expose her. So just having the peace of mind knowing, hey, whether I have it or not, that would really help a person like that.
All right, Kyle Aboshi, thank you. Of course, everybody at home, continue to reach out to Kyle. Talk to us here at The Story. Use the hashtag HeyDan. We want your questions, your concerns, your stories. Tell us the things you're going through. Again, thanks to Kyle.